Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
All right. Welcome one and all for this class tonight. We have UK MEC Criteria. It's a very drag topic, a very dry topic, but tonight I'm going to make it a very interesting, lively, and a very logical class. Okay. UK MEC is not easy to understand. It's not even easy to remember. But if you try to just, kind of break it down, as I'm going to break it down for you tonight, you will not only register it in your mind, you'll be able to reproduce it in the examination. Now, the question on UK MEC can be asked in theory, very unlikely so, but yeah, in theory, but it can definitely be asked in your practicals. Because if I'm your examiner, I would love to know the UK MEC criteria of certain important contraceptives. UK MEC, that means medical eligibility criteria, as you all know. It's just a way in which this European board, UK, has decided to place the contraceptives in high risk and low risk zones. All right. And see, the class is till what time? I can't say for sure right now, but yeah, it's going to be a small class because it's I'm just trying to infuse a criteria inside of you. It's not a very long, lengthy class. I have a very few slides to share with you, and I usually make my classes very small so that you can revise also in no time. And if you put me on the fast forward mode, maybe a little 1.5 speed or something, you'll be able to revise it even faster, right? So yeah. Hi, good evening, everyone. I am very thrilled to see my old students also in this class. And I do understand that diploma students, DNB diploma students might be studying right now and they might not be in the class. That's all right. It's a class which is going to be recorded anyways and put forth on my channel so that you all can revise it once. Please, guys, I do understand that you would love to see the classes again and again and again. I cannot still grant the requests of very old classes to be run back again. Ever since the paper 3 has come up of DNB diploma, there are requests for paper 1 and paper 2. Please understand this thing, guys. There are certain rules by which I have been going right from the very beginning. The class stays on for 1 week. Okay, you can watch it as many number of times as you want to watch it for one week, and then the class goes in the respective folder. And when I say respective folder, that means if it's a theory class, it goes in the theory folder. If it is a practical class, it goes in the practical folder. And if it's a class on answer bank or answers, it goes in the answer bank folder. Live class recording folder is definitely there, but it's only for theory classes. All right. So any conceptual points that I've given in theory, that goes in the live class recording. Anything to do with the practicals, it's a live class, but it goes in the practical folder, because otherwise the live class folder will be very ambiguous. You would not know what, it's a mixed bag. Okay, you're getting practicals also inside there, and that problem we were having before. So we tried to solve that problem, and now everything is in the organized respective places. So the classes which have been taken on the DNB diploma answers, they have gone in the answer bank. And the practical classes which I took before that, in which the mock Viva was taken by you students only, you presented a case and I was taking your Viva, they have gone in the respective practical folder case discussions. All right. Now, beginning with this class, as I was giving you a kind of introduction about UK MEC criteria. I can give, when a patient comes to me and she comes with a unique set of problems, that I am hypertensive, okay? But I'm not interested in copper IUCD. I want to go for a pill. I would have to counsel her accordingly that for you in your given age, parity, BMI, and then your added factor of hypertension, how good is a COCP for you? How good is a POP for you? And which mode of contraception will be the best in your given profile? That is called as medical eligibility criteria. To make it more specific, to make it more understandable, we have a set of rules. Now, I'll tell you what exactly you mean by that. So basically, there are guidelines for the safe use of contraceptive methods. If this question comes, this is how you will start it. You'll give an introduction. You cannot miss this slide when you start writing down on UK MEC criteria. And this is going to be the question. If at all it comes in theory, this is going to be write a short note on UK MEC criteria regarding the eligibility of certain contraceptives. That's it. They will not ask you regarding any particular condition because it's too small to write. It's too less to write. Okay, or maybe you can come to counsel a particular patient who is so-and-so BMI, so-and-so weight, so-and-so age, so-and-so parity. with the current problem of, or she's just gone through a GTD, this thing, or let's say an H-mole pregnancy, and she's just gone through a sexual evacuation. Immediately in the post-abortion phase, what is the contraception that we would like to counsel her? Counsel according to the UK MEC criteria. So this is now, I've seen the norm of DNB questions. They are very highly specific questions and mostly on clinical based scenarios, which is expected out of you at your place, because we're making you into a postgraduate student. Later on you'll become SRs in the given government institutes, and then you'll start running the OPDs. So this is expected out of you, right? So it's nothing out of league that we are asking you questions on. This is very basic, so you better know it. And I'll make it very, very fun, very, very interesting, and very logical. That's very, very important. Is you cannot learn it. You have to understand it. And once you do understand it, you will be able to reproduce it easily in the examination hall. So please just concentrate on what I'm telling you right now. So basically, what is UK MEC? I've already told you. It is just guidelines for the safe use of contraceptive methods in women with certain medical conditions or certain personal characteristics, right? So they're an essential tool for the healthcare providers. And what do? They have to be used effectively, safely, and they have to counsel properly the patient. This is, we call, we're giving them a bouquet of, choices. So amongst our choices, we have COCPs, we have POPs, we have injectable progesterones like DMPA, we have implants, and then of course we have copper IUCD, and you have LNG-IUS, that is Mirena. So now UK MEC criteria as a category 1, 2, 3, 4. If you do not know 1, 2, 3, 4, the entire next presentation will be alien to you. So I'm very sure all of you do know it, but let me hear it from you very easily, very easy. Like I have remembered, I think I have, see UK MEC, I'm very sure I've taught you before, but I'm taking it because even I was not able to find where exactly in contraception do I have it. I'm sure I have probably included it somewhere in the contraception, but I thought why not take a small class on it so that we can just clear the air regarding UK MEC, and there is a particular dedicated class so that you don't have difficulty in finding it out, right? So UK MEC category 1, 2, 3, 4, I have taught you before, and I usually teach it like this, but still you should have an understanding yourself. So come on, tell me quickly, guys, everybody who knows what is category 1, 2, 3, 4, easy language. The way I'm just about to tell you. If you're not able to get to me in an easy language, then I'll tell you the easiest way to remember category 1, 2, 3, 4. This is fine. No restriction is okay. Advantage of using the method generally outweighs. Agreed. How I write it is anybody answering? So I can move on. Usha is answering, my favorite. She's there again. Very good. So category 1 means you can give it easily. Just close your eyes and give it. No problem. Category 2, I always use this word. Yes, very good. This is usually how I teach it. Category 1 and 4, you should remember. 2, 3, you can negotiate. But it's very easy to remember category 2. Remember, category 2 means benefits outweigh risks. Category 3 become risks outweigh benefits. Okay? And category 4 is contraindicated. As simple as that. So just 1, 2 words. Category 1, no problem. Category 1, no problem. Category 2, benefits more, risks come. Okay? B more than R. 3's are more than B. Risks are more, benefits are less. And category 4, contraindicated. Now, I have a couple of slides after this. Okay, these slides are the ones which you can write a theory answer on. You can look at them later on. I will start from here. Okay. So first of all, let's start with the age. Okay. Do you think now, and these are the categories on which I'll be broadly speaking on. The last one is your pills, the combined hormonal contraceptive pills, which are mostly given in Indian scenario. And the first one is copper ICD. Again, a lot of us practice with these two only. Hardly I've seen people give POPs or DMPA, yes, of course, government institutes. Implants, hardly ever. LNGs, again, not so much. So copper ICD, DMPA, and CHCs, we are hovering around these, contraceptives. But nevertheless, implant is also asked, would be asked, because implant is now coming up, and it's got the lowest failure rate. I hope you all know that. The lowest failure rate is that of implant, 0.05%. All right, and it's very, very effective. At the same time, POPs also, of course, we have been giving, especially for the breastfeeding moms. Now, First category, which we'll concentrate on, is the age. Now, if I ask you, do not look at the table. Just think about it. Close your eyes and think about it. If I say that this is a girl, she's, unmarried, all right, obviously nulliparous, but she is in a, committed relationship. She's not about to get married any soon, but she is having regular sexual intercourse with a boyfriend or fiance or whatever, and she wants a contraception, and that to a long method, long acting, reversible contraceptives. That means LARC. So would you or would you not give her copper IUCD? She's a girl, let's say, of 20 years, or let's put it down to 21 years, all right? Let's put it to 21 years, and she is nulliparous. Whether we would like to give her copper IUCD, yes or no? How many of you say yes? How many of you say no? Okay, so she says, no, you will not give her a copper IUCD because she's nulliparous, she's never had pregnancy, she's unmarried. Why would you give her? Some people say yes. Yes. Some people say yes. My answer would be yes. I would give her copper IUCD. So what I'm trying to emphasize with this is just look at this parity. Look at the second. I put you on age, but I asked the question for the second column, right? So the parity, have a look at this. So it doesn't matter, according to UK MEC, it doesn't matter. The female is married, unmarried, nulliparous, doesn't matter. You can give her copper IUCD. This is what I wanted to emphasize, all right? So this is, the fun that comes in answering. If you are wrong, even better. You will remember it for a longer amount of time. That thing, it will strike you better when you answer wrong. So, yeah, STD definitely is going to be a problem with everything. If you give a POPs, you give a COCPs, everything, you will have to, be giving her a value contraception. Because why? Because young girls, they have a very high risk of getting not just STDs, infections like HPV and all. So definitely, yeah, you have to give her condoms. You'll have to give her barrier contraceptives. That is another counseling. But yes, that's this kind of a female who's in a relationship with your fiance, living maybe with him, and having regular encounters. She needs a proper contraceptive method without thinking much, and she doesn't have to pop a pill every time, especially in youngsters. It's very difficult to have the discipline in life to remember to make her have the COCP every day or a POP every day. So for these people, LARC works very well. Okay, can somebody quickly tell me the definition of LARC? I told you in the last lecture, as far as I remember, and I want you to just repeat it for me. What is the definition of LARC? This question is coming in the exam, guys. It's a very favorite of everybody, even mine.